Rivers have been described as the arteries of our planet. They convey water, sediments, and solutes from the headwaters to the oceans. These natural flowing watercourses are full of life and serve a source of important resources to sustain life on Earth. Analogously, we can also think of arteries as the rivers of our body. They are responsible for delivering oxygen and nutrients to all cells, and, like the rivers of the Earth, arteries follow their own course and branch off to different pathways. The extensive and intricate network of arteries in the human body is not always easy to follow, especially in complex regions such as the upper limbs. But don't blame yourself if you feel like you're getting lost. The main arteries of the upper limb. So what exactly will we cover today? Let's find out in this overview. The arteries of the upper limb supply oxygenated blood from the heart to the arm and forearm all the way to the fingertips. That is exactly the route we're going to follow during this tutorial. We'll start proximally by looking at the arteries of the shoulder, axilla, and scapular region. Here we'll talk about the subclavian and axillary arteries, as well as the anastomotic network around the scapula. We'll then move on to the arteries of the arm, the brachial artery and its main branch, the deep brachial artery. Moving further down, we will describe the arteries of the forearm, the radial and ulnar arteries. At the distal end of the upper limb, we will examine the arterial network supplying the wrist and the hand, with a special emphasis on the superficial palmar arch, the deep palmar arch, and the dorsal carpal anastomosis. Finally, we'll finish up with some clinical notes. Let's begin at the proximal end with the arteries of the shoulder, axilla, and scapular region. The artery supplying blood to the upper limb is the subclavian artery, an important artery located at the root of the neck, inferior and deep to the clavicle. The subclavian artery continues throughout the entire upper limb, changing name along the way based on the region it supplies. The right subclavian artery arises from the brachiocephalic trunk, while the left subclavian artery arises directly from the aortic arch. When the subclavian artery passes the lateral border of the first rib and enters the region called the axilla, it becomes the axillary artery. Throughout its course, this artery is closely related to the brachial plexus. In this image, you can see the axillary artery travelling through the winding brachial plexus. It gives off numerous branches, which mostly supply the musculature in lateral thoracic and scapular regions. Speaking of the scapular region, we have an important network of vessels here known as the scapular anastomosis. An arterial anastomosis refers to a group of interconnecting arteries, providing alternative route for blood supplying a particular region. The extreme mobility of the shoulder joint may result in kinking of the axillary artery and temporary occlusion of its lumen. To compensate, this important arterial anastomosis exists between branches of the subclavian and distal axillary arteries. The anastomosis provides an alternative route for blood to reach the upper limb if the axillary artery is blocked, thus ensuring an adequate blood flow to the upper limb, irrespective of the position of the arm. Now that we have explored the main arteries of the shoulder, axillary, and scapular region, let's move on to the arteries of the arm. At the inferior border of the teres major muscle, the axillary artery becomes the brachial artery. As its name implies, it is the main artery supplying the blood to the arm. It travels with the median nerve through the anterior compartment of the arm, deep to the biceps brachii muscle. Proximally, it runs medial to the humerus, before moving more anteriorly to lie between the epicondyles of the humerus, anterior to the elbow joint. Here it lies immediately medial to the tendon of the biceps brachii muscle. The main artery arising from the brachial artery is the deep brachial artery, which we'll look at in greater detail shortly. The brachial artery also gives off branches to the muscles of the anterior compartment of the arm, the humerus, and the anastomotic network around the elbow. The brachial artery terminates by bifurcating at the cubital fossa, giving rise to the radial and ulnar arteries, which are the main suppliers of the forearm. Before moving on to the forearm, let's take a closer look at the main branch of the brachial artery, the deep brachial artery, also known as the profunda brachii artery or deep artery of the arm. In this posterior view of the arm, we can see it more clearly. After arising from the brachial artery, it courses around the posterior surface of the humerus and accompanies the radial nerve within the radial groove. This artery is responsible for supplying the posterior compartment of the arm. The deep brachial artery also gives rise to branches that will take part in the anastomotic network around the elbow. The blood supply around the elbow region is derived from a number of periarticular anastomoses that are formed by the collateral branches of the brachial and deep brachial arteries, as well as the recurrent branches of the radial and ulnar arteries. This allows for blood to continue to flow distally, even when the brachial artery is kinked and occluded during elbow flexion. We're getting through it! Moving along distally, we're now onto the arteries of the forearm. The radial artery is the smaller of the two terminal branches of the brachial artery. It begins in the cubital fossa, just distal to the elbow joint, and descends through the lateral or radial aspect of the anterior compartment of the forearm. In the middle third of its course, it runs medial to the superficial branch of the radial nerve. Throughout its course, the radial artery gives off muscular branches to its neighbouring muscles. Now it's time to look at the other side of the forearm, to the larger of the two terminal branches of the brachial artery, the ulnar artery. Similar to the radial artery, the ulnar artery begins its course in the cubital fossa. It then descends along the medial or ulnar aspect of the anterior forearm before entering the palm of the hand alongside the ulnar nerve. Again, muscular branches arise from the artery along its course to supply the nearby muscles. Just distal to the elbow joint, the ulnar artery gives origin to the interosseous arteries of the forearm. The anterior and posterior interosseous arteries pass distally on the anterior and posterior surfaces of the interosseous membrane, respectively. They give off nutrient arteries to the radius and the ulnar, supply adjacent muscles in both the anterior and posterior compartments of the forearm, and finally take part in the anastomosis around the wrist joint. At this stage, what else is left for us to talk about except for the arteries of the wrist and hand? The hand and wrist receive their arterial supply from an anastomotic network formed by the terminal branches of the radial and ulnar arteries. Because this is a rather complex network, let's break it down into two parts. First, we're going to look at the palmar aspect of the wrist and hand, and then move to the dorsal view. We're going to start by looking at the palmar aspect of the wrist and hand. Here, the terminal branches of the ulnar and radial arteries give rise to two vascular arches, the superficial palmar arch and the deep palmar arch. The superficial palmar arch is formed predominantly by the ulnar artery, while the deep palmar arch is primarily formed by the terminal part of the radial artery. Both of these arches are located across the palm of the hand, but as their name implies, the superficial palmar arch is located closer to the surface in the palm. The superficial palmar arch also lies more distally compared to the deep palmar arch. To supply the digits, branches arise from both the superficial and deep palmar arches. Highlighted now are the common palmar digital arteries, arising from the superficial palmar arch. Now you can see the branches of the deep palmar arch called the palmar metacarpal arteries. These small arteries join forces with the common palmar digital arteries to supply the digits beyond the metacarpophalangeal joints. After passing through these joints, the common palmar digital arteries each bifurcate to give rise to the proper palmar digital arteries, which continue distally to the fingertips. Now it's time to turn to the dorsal aspect of the wrist and hand. Here we find the dorsal carpal anastomosis, also known as the dorsal carpal arch. This anastomosis is formed by the joining of the dorsal carpal branches of the ulnar and radial arteries. It also receives contributions from the interosseous arteries. From this network arises the dorsal metacarpal arteries, which are continuous with the dorsal digital arteries. Although the anastomosis allows mixing of blood supply to a degree, the radial artery mainly supplies the thumb and lateral side of the index finger. The remaining digits and the medial side of the index finger are mainly supplied by the ulnar artery. And that's it for the anatomy of the main arteries of the upper limb. Before we finish up though, let's take a look at some clinical notes. In this clinical section, we're going to focus on the brachial and radial arteries, which are the most commonly examined arteries in daily clinical practice. The brachial artery is suitable for assessing various clinical parameters, the most common of which is measuring blood pressure. The blood pressure cuff inflates around the arm to compress the brachial artery against the humerus, stopping blood flow. As the cuff deflates, it detects the pressure at which the blood starts flowing again to get systolic blood pressure. This is the pressure in the arteries just after the ventricles contract and eject blood into the circulation. The blood pressure monitor also gives the diastolic blood pressure, which indicates how much pressure the blood is exerting against the artery wall while the ventricles of the heart are resting and refilling. It's sometimes useful to palpate the brachial artery to assess aspects of the pulse, such as character and volume. Now looking at the radial artery, it is most commonly used to assess pulse. In the distal forearm, the radial artery lies immediately lateral to the large tendon of the flexor carpi radialis muscle and directly anterior to the pronator quadratus muscle. Here, it is only covered by skin and fascia, so the radial pulse can be felt by gently palpating the radial artery against the underlying muscle and bone. This is a common way to assess heart rate and rhythm. This is also an ideal vessel to collect arterial blood from to perform an arterial blood gas analysis, a test that measures the amount of oxygen and carbon dioxide in the blood, as well as the blood pH. And we're just about done! Let's take a quick look at a summary of what we learned today. We started by looking at the arteries supplying the shoulder, axillary and scapular regions, the subclavian and axillary arteries. We also explored the anastomotic network around the scapula. We then moved to the arm, where we identified the brachial artery and its main branch, the deep brachial artery. We then saw the arteries of the forearm, namely the radial artery and the ulnar artery. Finally, we studied the arterial network supplying the wrist and the hand, highlighting the superficial palmar arch, the deep palmar arch, common palmar digital arteries, palmar metacarpal arteries, proper palmar digital arteries, the dorsal carpal anastomosis, dorsal metacarpal arteries, and the dorsal digital arteries. In our clinical notes, we looked at the significance of measuring blood pressure at the level of the brachial artery and of taking a patient's pulse using the radial artery.
At the veins of the upper limb. As you're probably already aware, the veins of the body form a complex network that transports deoxygenated blood from the tissues of the body back to the heart. This network is so complex and variable that it can be tricky to learn and recall the important veins and their anatomical locations within the body. In this tutorial, we'll be focusing specifically on the upper limb, breaking it down to help you really understand the venous anatomy here. Starting with the venous networks of the hand, I'll take you upwards through the forearm and upper arm, showing you the various pathways the deoxygenated blood might take on its journey back towards the heart. Before we start though, I want to briefly cover a couple of concepts that will be useful for you in this tutorial, and for when you're looking at the arrangement of the venous system in general. I'll use this diagram here to help illustrate these concepts. Think of it as a really simplified cross-section with the skin surface being the top layer. The human body is a three-dimensional thing, and so the veins are not all located at the same depth. The veins of the upper limb can be subdivided into the superficial veins and the deep veins. The superficial veins are located just beneath the integument, which is just another word for the skin, and between the two layers of superficial fascia. Just as a reminder, the term fascia refers to the layers of connective tissue that serve to stabilise and compartmentalise the internal structures of the body. The superficial veins drain into the perforating veins shown here, which in turn drain into the deep veins. The deep veins of the body tend to run in parallel with their accompanying artery, sometimes in pairs and sometimes more, and these are known as the venae comitantes of that particular artery. Veins are often arranged in this way as the pulsation of the accompanying artery helps with the venous return. Vena comitans, singular for venae comitantes, comes from Latin and quite simply means accompanying vein. To further aid venous return, veins also have valves incorporated within them at regular intervals like the one indicated here, which prevent blood from moving in the wrong direction through the vein. Now that we have an idea of the general arrangement of the veins, let's dive in to look more specifically at the veins of the upper limb. But before we do this, I'll give you a quick overview of what we're going to cover in today's tutorial. So we're going to consider the upper limb in 3 sections, starting with the hand, where we'll consider the palmar and the dorsal views. Then moving up to the forearm, where we'll look at the superficial and deep veins separately so as not to get them mixed up. And finally, we'll look at the upper arm, where again we'll consider the superficial and deep veins separately. As promised, we'll start our journey in the hand and we'll look at the superficial and the deep veins that drain the tissues here. When looking at the palmar view of the hand, we can see both the superficial and deep palmar venous arches highlighted in green. These are closely associated with the palmar arterial arches of the hand, indicated here by this line. If we remove the arterial and muscular structures, this will help us to see the veins a little better. You can still see that the venous network appears a little messy and complex, and its arrangement does tend to vary between individuals. So it's perhaps good to take the positions I indicate here as a guide rather than a solid rule. The superficial palmar venous arch, as generally indicated here by this line, receives venous blood flow via tributaries from the common digital veins. The term digital in this case refers to the fingers. And if you stretch out the palm of your hand, you might just be able to catch a glimpse of the superficial palmar arch. The deep palmar venous arch, as indicated by this line, receives blood flow from tributaries of the palmar metacarpal veins and drains into the radial vein, which we'll also come to later on. If we flip the hand around to look at the dorsal view, we can see the superficial veins that make up the dorsal venous network of the hand highlighted in green. These veins can normally be palpated quite easily on the back of your hand, but because they're closely linked to the venous network of the rest of the hand, compressing these does little to affect the overall venous return from this area. As well as draining into the superficial and deep palmar venous arches that we just discussed, this network also drains into the cephalic vein and the basilic vein. The fact that this network can be so easily seen on the back of the hand makes it a good site for common medical procedures requiring easy access to the veins, such as venipuncture and cannulation. So now that we've covered the important deep and superficial venous networks of the hand, I'll take you on to the next stage of our journey, which is the forearm. I've broken this up for you so that we can look at the deep and the superficial veins separately so we don't get mixed up. And we'll be starting off with the deep veins. The first of these veins I'm going to show you are the radial veins, highlighted here in green. Let's zoom in so we can take a closer look. The radial veins are the venae comitantes of the radial artery, and they receive tributaries from the deep palmar venous arch, and travel up the forearm to drain into the brachial veins, which I'll talk about more in just a bit. If I take you over to the inner side of the forearm, I can show you the second of the deep forearm veins, which are the ulnar veins, highlighted in green. These veins are larger than the radial veins and are the venae comitantes of the ulnar artery. The ulnar veins receive venous blood flow from various sources, one being via tributaries from the deep palmar venous arch. They also receive branches from the veins that drain the anterior and posterior interosseous muscles close to the elbow, and a large communicating branch from the median cubital vein, which we'll also go over in more detail a little later on. The ulnar veins go on to join with the radial veins at the anterior cubital fossa, which is just another term for the pit of your elbow, to form other veins called the brachial veins in the upper arm. But before we travel further up to see those, we're going to stay in the forearm for just a little bit longer, as there are more veins here located closer to the skin's surface. I'm of course talking about the superficial veins of the forearm. The proximity of these veins to the surface of the skin means that they might be visible on your own arm. This makes them a great site for venipuncture, just like the dorsal venous network of the hand that we talked about earlier. So first we have the basilic vein, which runs up the ulnar side of the forearm, that is the inner side from our view, like so. If we strip away the surrounding anatomy here, we can get a better view. The basilic vein helps to drain the dorsal venous network of the hand. It travels further up the arm beyond what we can see here and terminates when it opens into the brachial vein, which I've mentioned already. We'll see this in just a bit when I take you further up the arm. Hopping over to the other side of the forearm, we have the cephalic vein. This one gets its name from the fact that it runs from the hand towards the head, as cephalus is Greek for the word head. It receives blood flow from the lateral aspect of the arm and forearm, as well as the dorsal venous network of the hand, and goes on to join with the axillary vein further up the arm in an area called the clavipectoral triangle to become the subclavian vein. Like other superficial veins, it tends to be seen as a good vein for drawing blood. As both the basilic and cephalic veins travel upwards and beyond the forearm, we'll be meeting them again soon. But before then, I want to tell you about a small but important vein, which is located here in the region of the anterior cubital fossa, which remember is just another term for the pit of your elbow. If we look at this a little closer, I can show you that this almost horizontal vein is the median cubital vein, and it serves to connect the basilic vein and the cephalic vein. This vein is the most common site for venipuncture, and it's also a site for the introduction of cardiac catheters during a procedure aptly named cardiac catheterization. We've now seen the most important deep and superficial veins of the hand and forearm, and so next I'll take you on to the final leg of our journey, which will be the upper arm. We're going to start with the superficial veins this time before we cover the deep veins, as you actually know them already. I'm of course talking about our old friends, the basilic vein and the cephalic vein, which we encountered in the forearm. These continue up the arm as I'm showing you here, and if we take a closer look at our anatomical Annie, we can see the upper arm portion of the basilic vein highlighted in green. If we go further and isolate the venous structures a bit more, we can see that the upper arm portion of the basilic vein is shorter than that of the cephalic vein, which is here, and that it terminates when it meets the brachial vein, where this circle is here. Jumping over to the other side of the arm, we can see the upper arm portion of the cephalic vein highlighted in green. This vein travels right up the arm and drains into the axillary vein here, in an area known as the clavipectoral triangle to become the subclavian vein. Moving on to the deep veins of the upper arm now, we'll start with a vein that I've mentioned a few times already and which I'm sure you're just dying to know about, which is the brachial vein. Zooming in here and again isolating the venous structures will help to show more clearly that the brachial veins are deep veins formed by the union of the radial and ulnar veins down here at the anterior cubital fossa. The brachial veins are the venae comitatantes of the brachial artery, and receive many perforating branches from the anterior and posterior compartments of the arm. The brachial veins unite around here and join with the basilic vein to form the axillary vein. Speaking of which, the next vein we're going to look at today is the axillary vein, which we can see here highlighted in green. If we were to dissect through the surrounding structures like so and take a look at this image here, we can get a clearer look at the axillary vein highlighted again in green, with the muscles of the upper thorax transected to help you get a better idea of its location. The axillary vein is an important vein that receives venous blood flow from several sources. Stripping away the surrounding structures even further allows us to see this more clearly. It's formed by the union of the basilic vein and brachial veins down here, and also receives tributaries from the cephalic vein and from branches that correspond with the branches of the axillary artery. We can also see here that the axillary vein increases in size as it ascends, and ends at the lateral margin of the clavicle here, where it becomes the subclavian vein. If we look again briefly at the previous image, we can see how the axillary vein carries on to travel behind the clavicle. This is the point at which it becomes the subclavian vein, highlighted now in green here, which is the last of the major veins of the upper limb that we're focusing on today. This vein, as we've just seen, is a continuation of the axillary vein. Like a lot of terms in anatomy, we use this vein's name to help determine its location. Subclavian can be simply translated to beneath the clavicle, which we can see pretty clearly in this image here. Of course, the venous return doesn't just stop here, it continues on. If we remove some more of the surrounding structures again, We can see that the subclavian vein joins with the internal jugular vein coming down from the head to form the brachiocephalic vein. It may be helpful to know that sometimes the brachiocephalic vein can also be called the innominate vein. Moving further on, we can see that the brachiocephalic vein goes on to drain into the superior vena cava, returning the deoxygenated blood to the heart so that the cycle can start again. Before finishing the tutorial, I'm going to give you a quick summary of what we've talked about today, which will hopefully help you see how the veins of the upper limb connect to each other overall. We first talked about the arrangement of the veins in general. So we have the superficial veins, which are located beneath the integument or skin and between the two layers of superficial fascia. The superficial veins then drain into the perforating veins, which go on to drain into the deep veins. The deep veins are often in pairs accompanying an artery, so that the pulsation of the artery can aid the venous blood flow. These pairs are known as venae comitantes. In addition to this arterial assistance, veins also have valves distributed at regular intervals, which prevent the blood from travelling in the wrong direction. Next, I talked about the veins of the hand, which from the palmar view included the superficial palmar venous arch, which receives blood flow from the common digital veins, and the deep palmar venous arch, which receives blood flow from the palmar metacarpal veins. If we flip the hand over so that we have a dorsal view, we can see the dorsal venous network highlighted in green. Like a lot of the superficial veins in this tutorial, this is one example of a great site for venipuncture and cannulation, due to its proximity to the surface of the skin. Moving upwards to the forearm, we have the deep veins, which consist of the radial vein and the ulnar vein. As for the superficial veins, we talked about the basilic vein and the cephalic vein, which are joined by the median cubital vein in the region of the anterior cubital fossa or the pit of your elbow. This small vein tends to be another good site for venipuncture. Next we reach the upper arm. Here we continued following the superficial veins that we had previously met in the forearm, including the basilic vein and the cephalic vein. As for the deep veins, we covered the brachial vein, which joins up with the axillary vein in the clavipectoral triangle and goes on to become the subclavian vein. Finally, I showed you briefly how the venous blood flow carries on into the brachiocephalic vein, and then into the superior vena cava. This is the point at which the blood reaches the end of its cycle through the body and is returned to the heart. And that's it from me today. I hope this has helped you to improve your understanding of the veins of the upper limb, and thank you for watching.